Good morning. Yes, Dr. Sweta, how are you?
How are you, ma'am?
Very good. How are you?
I am fine.
Okay, so we are going to be on, this
Yes,
webinar.
yes, ma'am.
Okay, so what all you are now doing? What are you doing right now?
Ma'am, there is a PRP patient and I'm going to do that now.
Perfect, perfect. Okay. So there are so many doctors who've already joined, and there are more joining. Yes, Dr. Shweta, you would like to say something about the DNCC Academy? You learned from us what all things and how confident are you right now? So many doctors are already online. You can share your views.
Yes, ma'am. That is quite. I have told you in my YouTube channel also, which we have given on. Now we have updated on YouTube, and now I'm very much confident with all the hair transplants procedure and PRPs.
Okay.
Very nicely, ma'am. I handle everything here very nicely, and patients are also very satisfied from my treatment. This is all because of you and DNCC.
It's your thing, how you cope up with it. It's all, it's all together. Yes. So all doctors, again, they also can introduce themselves so that we know them better.
Hi, good afternoon, ma'am.
Yes. Hello, doctor. How are you? What's your name, doctor?
Dr. Dhananjay Chavan.
Sanjay Chauhan. Okay. Where are you from, doctor?
I'm from Bid, ma'am.
MP.
Bid, Maharashtra.
Here, Maharashtra. Okay. So what are you practicing as, doctor? You're a
Now I'm preparing for NEET, ma'am.
okay. And you've done
Yes.
dentistry.
Yes, ma'am.
Okay. So BDS you finished when?
Last year, ma'am.
Okay. You know, so many dentists are entering into this line.
Yes, ma'am. Yes.
Even after doing MDS and all other branches, they are all entering into this field because this is such a good field. You know, hair transplant, you learn hair transplant, you learn trichology, you learn cosmetology. And as dentist, you know, it is like, you know, when you're doing the oral surgery, you can
Yes, ma'am.
analyze their skin, you can, give them
Yes.
anything that goes Botox, go for fillers, go for all that.
Yes, ma'am. Yes.
Nice. Nice to have you, sir, here.
Thank-
Good afternoon, everyone. Myself, Dr. Shivani. I would like to welcome you all on the behalf of DNCC Academy. Okay. So, as you all know, today's our topic is hair and skin industry. So, trichology and cosmetology. If you enjoy helping others to look and feel best, then this is your course. So you should join this industry. Career in skin and hair industry are always in demand. That is recognized in India and across the world. The webinar could give this webinar could give you insight in the career opportunities available for the certified courses, namely trichology, cosmetology, and hair transplant. Our founder is Dr. Nishita Seth. She is dermatologist from Cardiff, UK. Even she is the internationally trained obesity consultant and laser consultant. Our co-founder is Dr. Prashant Vikram. He has the 20 years experience in the field. Even he is skilled in skin procedures like tag removals, skin biopsies, chemical peels, tattoo removal, and pigment removal. I would like to share some more information about DNCC. So, DNCC is the vision of Dr. Nishita Seth with the pioneer concept of providing a complete range of hair and skin treatment, both the surgical and non surgical. DNCC harnesses the latest scientific and technological innovations to provide the highest quality of patient care. Dr. Nishita inaugurated her first clinic in 2005 at Bandra, Mumbai, which has turned out to be a great success. DNCC rapidly expands across the state, Maharashtra, Goa, Gujarat, covering the 8 major Indian cities. I would like to share some milestone and some awards and recognition which is given to Dr. Nishita. She is awarded as Woman Achiever of the Year 2009 by Health and Education Society India. She is International Woman Achiever of the Year 2012 by Health and Education Society India. We have been awarded Best Clinic Award in 2009 by Health and Education Society of India. I would like to share some milestones of our brand DNCC. We have been transplanted 1 crore and 50 lakh roots in last 4 years. We have successfully treated 5,000 patients and we have more than 50,000 happy patients with us. We have 8 fully operationally clinics which is stated Bandra, Thane, Panjim, Rajkot, Ahmedabad, Vadodara and Surat. Why you should join our courses? So basically DNCC is best surgical and non-surgical skin and hair transplants. DNCC meets international standards and clinical best practice. DNCC has qualified dermatologists, cosmetologists and weight loss specialists. DNCC has the well-trained nurses, technicians and support staff. DNCC is equipped with the state-of-art medical equipment and we have highly quality of patient care. DNCC is providing various treatments in hair. We are performing hair transplant, hair regain therapy, even PRF and PRP. Even we are providing treatment for alopecia and dandruff. In skin treatment, we are doing skin polishing, wart, mole removal, acne reduction, stretch mark reduction, laser hair reduction, laser skin tightening, laser tattoo removal, botox, fillers, peels, and thread lips. In cosmetic surgeries, we are performing liposections, breast implant and reduction, nose reshaping, tummy tuck, male breast reduction, and facelift. In weight loss, we are giving HCG diet and performing bariatric surgery. Now, I would like to welcome Dr. Nishita Seth. Ma'am will continue further.
So I welcome you all in this webinar and thank you, Dr. Shivani, for a great insight of our DNCC. Okay, so why, when I wanted to learn this back in 15 years back and there was no institute available in India. I had to go to London, I had to go to Cardiff, UK for getting trained into all this. So I thought, let us just start this. So we started our first branch in 2005 and then I thought, okay, let me also start the training doctors. So we started first batch in 2009. Okay, idea, why I wanted to enter into this because it's a $1 billion hair and skin industry worldwide and flourishing at a rapid rate. And there is a constant need of skilled technicians, dermatologists, trichologists, and weight management specialists, and cosmetologists. So we wanted to provide specialized courses and hands-on experiences necessary to give our students fulfilling the wish and financially rewarding career in the industry. There is a rising population of men and women who wants to look good with a good volume hair on head. The market for hair restoration treatments are expected to grow at a CAGR, that is a growth, more than 25% in major cities. Nowadays, everybody wants to maintain a youthful appearance and look good. This leads to a favorable job outlook for cosmetologists. The demand for cosmetology procedures and specialized services is expected to grow by 16% between 2018 till 2028. What is trichology? Now, if the question comes in our mind, Why this specialized course? Because these courses are not available in the medical books, in the dermatology, in the plastic surgery, in dentistry, in MBBS, nowhere it is there. So that is why we thought, okay, let's just train good doctors into this field so that they can add up onto their practice. While doing the dentistry, you can even combine this as a cosmetic treatments and all, and you can earn in lakhs. What is trichology? So, trichology is the scientific study of the hair and scalp, which causes the hair fall, hair breakage, hair thinning, and miniaturization of hair, and disease of the scalp and its treatment. Now, our mastery is into hair transplant. We are, I can say, as a dermatology level, we are now leading brand into hair transplant. I started hair transplant like 7, 8 years ago, and we last 4, 5 years we have been doing every month more than 100 hair transplant, which is a big number for any dermatologist to do. Hair transplant is a surgical procedure that removes hair follicle from one part of the body that is called the donor area, which is this donor area is the back of the scalp, and transplant to a balding area of the scalp known as the recipient area. So when there are so many patients, when I meet them 1 year ago and when I see them as a patient, and then after 1 year when I see them, I can't recognize them. They walk with the confidence and they look so good. So that's about the hair transplant. So we are training into hair transplant also. And what are the other treatments regarding to hair loss? That is PRP and IPRF. Now, what is PRP? So, PRP is platelet-rich plasma, and it is from your own blood. We extract the growth factor and promote hair growth and healing. But with the recent research on stem cell treatment, PRP has now moved on to IPRF, which is called injectable platelet-rich fibrin. So, platelet-rich fibrin is uses the body's regenerative properties, having a higher concentration of the growth factor and stem cells to treat wrinkles, fine lines, and volume loss and joint degeneration. It is also used in many other joint disease and many other medical problems. Then we also when we do the hair transplant, we always combine it with the PRP and hair regain therapy. So what is this hair regain therapy? So hair regain therapy is a personalized approach for hair loss using FDA approved medicines, microneedling, low intensity lasers, PRP and IPRF treatments, and meso hair therapy. So when you all enroll with this courses, I can teach you in details what everything will do for treating the hair loss. These are some of our patients' pictures. These are all my own patients. So you can see we have, I met the patient 1 year back and I can't recognize after 1 year because they are with the full head of hair and they look different. They look 10 years younger. So, what is then coming to the cosmetology? What is cosmetology? So, cosmetology covers varied aspects of hair and skin care applications of beauty treatments, hair reductions, that is lasers, then accurate treatment, hyperpigmentation treatment, skin rejuvenation. Now, if you all know, cosmetology is a growing industry, and studying cosmetology can be a stepping stone for a variety of well-paying careers in the health and beauty industry. So our different types of cosmetology treatments are skin polishing, then warts, mold removal, scars, acne reduction, stretch mark reduction, laser reduction, laser skin tightening, laser tattoo removal, botox, fillers, creams, and thread lips. Some of the popular cosmetic procedures for improving the look and feel of your skin are Botox. If I explain you very little about Botox, is it reduces the appearance of lines and wrinkles by freezing the muscles, not by paralyzing the muscles or blocking certain nerves. And that is time being, so like 4 to 6 months, you have very good, fantastic results. Your this, if you all see my forehead lines, I inject my own Botox on myself. I have that much confidence. Then coming to the dermal filler, this procedure involves injecting hyaluronic acid and fillers into the skin, which will plump up the lines, and it can also give you cheek enhancement, it can give you lip enhancement, it can give you lip filler. Then coming to chemical peels. So we all go, previously this chemical peels was not very common and not very famous in India because we used to all go to the parlor and salons to get the facials and all done. So if I put that facials and chemical peels together, so my 10 facials is equal to one mildest peel we do in the clinic. And peels are mostly done by doctors, not by beauticians, because we know exactly how much contact time is to be on that peel is to be on the skin. So we know the end point of every chemical peel. A chemical peel treatment involves applying a chemical solution to treat the damaged skin, wrinkles, acne scars, age spots, freckles. Then we come to laser skin resurfacing, which treats the wrinkles, uneven skin tone, age spots, and scarring. Microdermabrasion, if you all know about diamond polishing of the skin, which is got a diamond tip and it removes the many layers of your skin, which is got a diamond tip, so and it can be helpful in many age spots, enlarged pores, acne, minor lines or scars, and also to treat the stretch marks, we use the microdermabrasion. Then laser hair removal, you all know it is so famous that every bride wants to go for the laser hair removal. Laser hair removal is it's called laser reduction basically. Every female wants to have a nice, hairless skin before the wedding day. So we come to some of our successful skin treatments. I don't know if you all can see the the result, but yes, we will show you our own patients how we have treated them, the acne, the lines, the aging lines. We also do the fillers and all. Right now, I'm sitting in my Goa clinic. So Goa, we have this December, we have so many patients from the foreign, from the outside of the India. They come in for all these procedures because back in the country, the procedures are 10 times expensive than India. Okay, why then now again, if I tell you all why opt for a course in trichology and why opt for a cosmetology courses? Nowadays, people are more concerned about their looks and they are willing to spend on grooming and treating hair related issues. Most medical courses do not focus on this issue. As I just told you all that when I wanted to learn, there was no one who was teaching in India properly the trichology or a cosmetology. I had to go out of my comfort zone. I had to go out of India and get the training done. I spent so many lakhs in that. Now, the skin and hair industry offers very good career. After completion of the course, you can practice as a trichologist, a hair care therapist, or a hair consultant. and your cosmetology doctors. Okay. Average salary earnings for trichologist or a cosmetologist. I see there are so many dentists attend today's webinar. So why dentists are entering into this field? It's only because I have almost 15 to 20 dentists working in my all the centers, and when they come in, they learn from me, and then they start giving the anesthesia and all into our hair transplant. So the salary earned by a trichologist or a cosmetologist is superb. It is so good. A trichologist or a cosmetologist can get a salary from starting from 15,000 to 20,000 to it can grow to say 55,000 to even less. That is salary per month. Even doctors, then doctors are adding into their clinic practice all this treatments. They can earn 4, 5, 6, 10, 10 lakh rupees a month also. There are many of my students who are already earning in lakhs by doing this type of courses. How to set up your own practice in clinic. After successful completion of the course, the doctors will be equipped with a sound knowledge and skills, and then the DNCC has a team of renowned experts with which we can help you set up your own center. We can help you in all the challenges which actually in today's time we have our own softwares, and we have our own marketing team. We have our own call center, digital setup, everything we have. So we can help you set up the clinic, and we can help you in each and every step of your practice. We provide business model training. Establishing your own practice is an excellent business opportunity to get you onto the path to a secure financial future. Our business model training includes we can create a business plan for you. We can find a good location, invest in the right equipment, find the right staff, and plan ahead for the growth. Future scope and earning for trichologists and a cosmetologist. People are now more conscious about beauty and health, so trichologists and cosmetologists will always be in demand. Those gaining adequate hands-on experience can start their own clinic and earn in lakhs, as I told you, depending on the number of patients, hours of work, and fees charged. Trichologies have immense opportunities abroad also, but then for abroad, they need to go through the qualification tests, and they have their own countries test and their own rules. So you have to go through it, but you have a complete knowledge before going, and you know exactly which direction you want to go into. So, how dentists or maxillofacial surgeons can benefit by becoming certified trachologist or a cosmetologist. Dental practice is adversely affected right now, only I'm telling you right now due to pandemic. Investment in setting up a skin and hair clinic is less than a dental clinic. So because I have so many dentists working with me, I ask them how you want to set up. Then they say, "Ma'am, we need at least 15 to 20 lakh rupees for setting up our dental clinic." And then you start from a very small amount. Here, this investment is not very high, and you can add up one by one, like add on to your existing practice, the hair, then the skin, then the lasers, then obesity, and then cosmetic surgery, and then anti-aging and all. So return on investment after completion of course is much easier in this field. Qualifying as a trichologist or a cosmetologist would ensure a lucrative practice apart from your existing practice. Okay, so we have three type of courses. One is certificate course in trichology. So there are many institutes, they are advertising of diploma and degree and all that. But I know there are no degree courses basically, and there are no diploma courses because if you have this knowledge certificate course is enough to start your practice. A certificate course for trichology is for paramedical staff, beauticians, and even 10, 12 pass because in that we're not, we're only going to give them training on to hair transplant, the extraction, the nicking, and the implanting. So we teach them about the hair and scalp anatomy, hair analysis, then investigation and treatment of hair scalp problems, hair fall therapies, laser scalp stimulation therapies. We teach them PRP therapy, microneedle therapy, hair thinning therapy, hair volume enhancement, and the course is for basically if they are 10th, 12th pass, they have to be with us for at least 3 months observership and 3 months hands-on practical and all that. So after mostly after 1 year, the person will become a very good technician. Okay, the second course we have is certificate course in cosmetology. This is mainly for medical doctors like MBBS, MDS, BDS, BAMS, BUMS, BHMS, any pathies can attend this course. Only thing which we are not going to teach, we will be giving you theory knowledge about Botox fillers and thread lift and all, but that too only MBBS, MDS and BDS, they can inject and they can actually do the procedure, but other doctors can have a visiting doctors in their clinic and then they can perform, but not themselves, but other visiting doctors like dermatologists or MBBS or any other doctors. If you hire, you can practice in your clinic, but you have to have as a medical doctor, you have to have a doctors performing the procedures. So what we have in our this syllabus will be there will be clinical cosmetology, then there will be advanced skin aesthetics, there will be lasers, there will be fillers, Botox, anti-aging therapy, vampire facelift. So what is vampire facelift? It is nothing but PRP facelift. Then peels, then PRP therapies for stretch marks, for scars, for strias and all that. Then we teach you microneedle therapy, physiotherapy. The duration of this course is 3 days. We will give you theory knowledge. That is 3 days, 24 hours and 3 months observership. See now practicing doctor can actually do it on their own comfort level by coming to the nearby center only on Saturday, Sunday, or only on Sunday. They can come and observe and then they can start doing in the clinic. Then there are certificate course in FUE hair transplant, which is for strictly for MBS, BBS, MBBS, dermatologists, and plastic surgeons only. So here we teach scalp anatomy and physiology, types of alopecia, patient medical history, patient evaluation and pre-operative diagnosis, FUE method of hair transplant. There are two methods, FUE and FUT, but nowadays FUT is actually not done by many, and we teach you FUE method, and we have been, giving fantastic result with only FUE. We have done more than 5,000 patients till now in last 4 to 5 years. We also will teach you what all equipments we have to get for hair transplant surgery. Then staff required for hair transplant surgery. Then initial consultation and pre-operative preparation and pre-operative. We will give you all the forms and consent forms, pre-operative checkup forms, then intraoperative what all you have to monitor and all that. Then anesthesia and sedation, we will also train you into that. Hair transplant stages like marking, then extraction, then nicking, and then implant. Then post-transplant recovery, follow-ups, when to follow up with all the patients, outcome of the patient's hair transplant. Then we will also go through complicated case studies, hair transplant clinic setup. So what all things you require to set up the center, then hair transplant market, and then question and answer sessions. Duration of this course, again theory, if you've done basic of all that, then 3 days theory will be enough. Then 3 months observership and 3 months hands-on practical. Again, it depends on your practice. If you are busy doctor, then you can come only on Saturday and Sunday to our nearby clinics and observe and do the practice. So now I hand over to again Dr. Shivani for details about this course and everything. Now, if you all have any question regarding anything, you can put it on the chat section, and I will answer all whatever questions you have. Yes,
Yeah.
Dr. Shivani.
Thank you, ma'am. Okay, so we have this amazing offer. If you enroll yourself today with us, you'll get this certified course in trichology at rupees 50,000. Same certified course in cosmetology at 50,000, and this certified course in FU hair transplant at 1 lakh rupees. Okay, so now we'll move further for the question answer section. If you have any questions regarding courses or regarding anything, you can just ask to Dr. Nishita ma'am. She'll answer your question.
Okay. What are the types of machine to be kept in the clinic?
Kept in the clinic, yeah.
Uh, Dr. Rakhi Desai. Okay, now Dr. Rakhi, there are so many things which we have to actually keep in the. I can give you a list when you enroll for the procedure for the courses. We will give you from needle to performer, the FUE machines and everything will be given to you, but they are not very costly. So now there are, if your question is not, it is like what you were asking for which course you want the machines details. So just ask me regarding that. Where is the Mumbai center located? We have a center in Bandra and Thane. We have a center in Goa. We have centers in Gujarat all over Ahmedabad, Baroda, Surat, Rajkot. Okay, somebody has asked, is this certificates are valid in Canada and UAE? I just told you all that these certificates are actually certificate course. We are giving you the knowledge. The Canada and UAE, you will have to undergo their countries required test and qualifications. Anything else? Okay. You would be interested in cosmetology and setup required.
Once I undergone the certification.
Okay, I would be interested in cosmetology and setup required once I undergo the certification. Yeah, perfect. We will do that, dear. Rakhi, we will definitely help you in that. Cosmetology, you will again have to start with minimum, say, from the peels to botox to fillers to all that. So for DHA and HAAB, this would help. DHA is what is that, dear DHA? Are you asking about the Dubai Health Authority? Yeah?
Yes, ma'am.
Okay. So, no, dear, this is not, I just told you all, these are not the part of any books. So, we are only, yes, you can definitely practice in India, but legally, there are no legal, even if the person is giving you a degree certificate or a diploma certificate, as this is not a part of curriculum of any books, any courses, any university. I cannot give you anything illegally. But my students have opened their own centers and they are all practicing since last 2009. I've trained so many doctors and they've been practicing. So if you have a basic qualification for whatever you are doing, definitely you can do it. You should have a demarcation line. Says now if you are a BHMS doctor or a BUMS doctor or a BMS doctor, you cannot practice Botox, you cannot practice filler, you cannot practice red lip. Other than that, chemical peels, yes, you can do. Laser hair reductions, you can do. All that can be done, but other things you are not allowed, or even see for me right now, I'm a dermatologist. I cannot perform plastic surgery, but I have a plastic surgeon attached with me who is looking care or who is taking care of all my plastic surgery cases like liposuction, tummy tuck, breast implant, and all that. Dr. Rakhi, I know you are from Splendora, right? I know. Doctor, I know, I stay in Yoga Splendora too. So, I know. I was thinking that Dr. Rakhi Desai means it must be my neighbor only. Small world. So at present, my polyclinic is under renovation, so how much area should be dedicated to set up a skin clinic in future. I do have a dermatologist and a cosmetologist attached to the place. You can start, see, you cosmetology clinic, you don't need a big clinic. You can do it from 400 to 500 square feet center also enough. You have to have one chamber for skin, one chamber for hair, one chamber for other procedures. So 2 to 3 chambers enough for the hospital. Anybody has any more question? Go
And
ahead.
I'm learning everything over here, and it is quite fruitful for in future, as ma'am said. Whatever ma'am has said, all I have learned here, and it has been great experience of learning.
So what all things
And
you are
I
doing
will
in
thank.
Dr. Shweta? What all things now you started doing after learning all this? Can you tell us, please?
Yeah, everything regarding hair transplant, PRPs, and hair anesthesia, sedations, intraoperative, preoperative, postoperative, patient care,
Wow, nice.
all everything. And it has been 8 months I'm working over here, and I've learned a great. And now I'm with here with the consultation and preoperative and postoperative care also.
Wow,
So
nice.
it has been great going, ma'am. Thank you once again.
Happy to have you
So,
here.
I will say that every doctors must join DNCC for a great future and learning over here.
Thank you.
So I've been working with DNCC, so it's a great opportunity to work with, especially Dr. Nishita. So yeah, I have a good experience over here. I'm like doing patients and everything. So it's a very good field. So if you are if you want to join, if you want to start up your own clinic, you can do that too. So yeah, thank you so much, ma'am.
Dr. Shweta and Dr. Shivani both are dentist doctor and they are doing excellent now and we are very very happy to have them.
Thank you, ma'am. Thank you. So basically, I hope we all the queries are done. So we are winding up this session. I would like to thank Dr. Nishita for her valuable time. I would like to thank all the participants too. And if you have any doubts or any queries, you can reach out to us. We will get back to you sure. And I would like to request you all to subscribe our channels on Instagram, YouTube, Facebook, and just like and subscribe our channel. Thank you so much,
Thank
everyone.
you very much, Dr. Shivani, Dr. Shweta. And the doctors, thank you
Thank
very
you,
much.
ma'am. Have a
Thank
good day,
you.
everyone. Thank you.